Good morning, everyone. My name is Dr. Patricia Johnson, and I will be your presenter this morning. I have a bachelor's and a master's degree in food nutritional science that I would have received from the Tuskegee University in Tuskegee, Alabama, and also a degree in food science and technology from the University of Nebraska in Lincoln, Nebraska. Um, I worked for Kraft Foods for, they give you some professional, a chance to work for 1 year after your degree. So I worked at the Kraft Foods for a short period of time, about 6 months, before coming home in their ingredient technology department. And when I came home, of course, after a couple of years, I actually worked for a term or two at UE teaching a nutrition course. And then I was brought on to the then College of the Bahamas, which is now the University of the Bahamas, where I worked for 10 years. Following that, I then went to and of course, when I was at the College of the Bahamas, I taught in the chemistry, environmental, and life sciences school. And then following that, I went to the Bahamas Agricultural and Industrial Corporation, otherwise known as BAIC, where I was both the manager of product development and also the manager for the public abattoir, representing that particular agency as they were the managing agency of the abattoir. And then, of course, following that, I came to BAFSA, the Bahamas Agricultural Health and Food Safety Authority, BAFSA. That's the correct way to say it. And I've been in this post now from 2018 as the Director of Food Safety and Quality. And so with that, I will get started with today's presentation. So let me just share my screen and I will take off my video. Can you see that?
Yes, you're saying it.
Thank you once again, Dr. Moxie, and good morning to everyone.
Good morning.
First of all, yes, good morning. First of all, I just want to bring you greetings on behalf of the management and staff at BAFSA, the Bahamas Agricultural Health and Food Safety Authority. Today, I am representing the Food Safety and Quality Unit at BAFSA, where I'm the director, as I said before. And on the screen, you will see the shield. The shield symbolizes basically BAFSA's mandate in a nutshell. And that is to protect food safety. And you'll see that with the plate and utensils. It is also to protect plant health. And you'll see that with the pineapple and the plant leaf. And finally, to protect animal health, which is depicted by the chicken and fish. It's a huge responsibility, but a very critical one, particularly at this time in the history of the world with the coronavirus pandemic. And then, of course, you have the wars that are happening, and then there's climate change. I mean, we see all the weather patterns that are changing, okay? And these are basically stretching mankind to his limits. And as a result, food safety, food security, and plant and animal health are at the greatest risk to global populations. So what is BAFSA? In 2016, 4 acts were gazetted in the establishment of BAFSA. But it was not until 2018 that the authority began to bring on its staff complement. As a regulatory body, BAFSA has the responsibility for implementing SPS measures, that is sanitary, which is associated with animals, and phytosanitary, which is associated with plants. Okay, sanitary and phytosanitary measures, SPS, and as it relates to food safety, plant and animal health. So these 3 areas are intricately connected, as you will see later in the presentation. Once SPS measures are applied, we can effectively defend against threats to the integrity of the agricultural health and food safety system, and also ensure the facilitation of safe agri-trade. So this morning, the focus will be on the veterinary health unit, but to put things into perspective and see how they're connected, we must also understand the role that each of the other units at BAFSA plays, okay? So the Food Safety and Quality Unit functions in the regulation of food safety along the entire food chain. That means from farm to fork. And as you will hear, as it relates to marine life, from the boat to the throat, that's one of the terms, or fish to dish, so there are other terms that can be used. It also regulates all food, including meat and fish, including all beverages like water, alcohol, etc. All right. The Food Safety and Quality Unit protects human health, consumer interests, and ensures fair practices in trade. The Plant Protection Unit is charged with preventing the introduction and spread of plant diseases and alien invasive species to protect, promote, and maintain the health of plants, including forestry and wild flora. The Plant Protection Unit also promotes the use of good agricultural practices, otherwise known as GAP, and regulates the trade of plants, plant products, and other regulatory articles. So that brings us to the meat of today's presentation. Here we have a picture of the late Maurice Isaacs. He was a dear friend and colleague and is sorely missed by those he would have impacted throughout his career and life. Dr. Isaacs was, like me, a first in that he was the first director for the Veterinary Health Unit at BAFSA, a post he held from 2018 to 2021. I also had an opportunity, as I mentioned before, to work alongside Dr. Isaacs when he was a manager at the public laboratory on behalf of the Department of Agriculture, and I was a manager at the same facility on behalf of the managing agency, which was BAIC. Okay, so the presentation from this point was prepared for the most part, save a few additions by Dr. Isaacs. Okay, and I'm happy to be able to share this information with you today. So this slide here depicts the relationship between agricultural health and food safety. From the Venn diagram, clearly food safety is a key factor in achieving agricultural health in both plants and animals. Remember early on I said that the Food Safety and Quality Unit is responsible for the regulation of food safety along the entire food chain. That means in the fields, at the point of planting to harvest, and from the point of initial livestock rearing to slaughter, straight to the consumer's plate. Therefore, in order to maintain animal and plant health, food safety principles or measures must be employed from the primary level of production to the point of consumption. So one world, one medicine, one health. Here we have a depiction of an umbrella explaining the One Health concept. It is a strategy that brings together multidisciplinary agency collaborations and communications seen from the first tier under the umbrella. Okay, see all of those different areas. And that is as it relates to to the health of humans, animals, and also to the environment. The synergism achieved here will advance healthcare, biomedical research discoveries, enhance public health efficacy, expand the scientific knowledge base, and improve medical and clinical care in the 21st century. And if properly implemented, it will also help to protect and save untold millions of lives for generations to come. Let's look a bit closer at the two large circles. Let me see if I can enlarge this here, and let me know if you will see it enlarged on your screen. Let me see here. Can you see it enlarged?
Yes, we can.
Okay, wonderful. Okay, so these circles here, so it shows the shared diseases between humans and animals as a result of zoonotic infection. So these, of course, can lead to global health issues, bio threats, AMR, which is antimicrobial resistance, and food safety becomes a major concern. But of course, you must have certain things in place. So intervention is key. So intervention is paramount in terms of ensuring that measures are in place to lessen these effects and promote One Health. So you have to have some constant surveillance taking place. You have to, there must be some vector control, sanitation, and of course, the administration of effective vaccines and therapeutics. Right? So on this next slide, what is One Health from concept to action? So what I want to show you here, I hope it plays. Oops. Let's see if we can go back and, there we go. I want to play this short video. It's only about just a little bit over two minutes. And let's get a better idea of this One Health concept.
Meet Musa. Musa is a veterinarian. With other animal health professionals, he helps fight animal diseases and improve animal welfare. You know that. But did you know that in doing so, Musa also helps keep you and your family healthy? The far-reaching impacts of Musa's work should not come as a surprise. In our globalized world, we are all interdependent. Animal diseases can affect the health of people, and human diseases can affect the health of animals. For example, when humans cut down trees, they affect the balance of the ecosystem and of all the creatures living in it. Usual ecosystem services such as food provision or carbon capture can become a challenge. Wild animals are sometimes forced to flee their natural habitats to find sources of food getting closer to villages. Animals and humans that should never have interacted so closely suddenly do, and dangerous pathogens can jump from one species to the next. Sound familiar? Around 5 new human diseases appear every year. 3 of them are of animal origin, as for example Ebola and most probably COVID-19. 60% of existing human infectious diseases come from animals. Deforestation is just one example. Unregulated wildlife trade, climate change, all affect environmental health, and with it, animals and humans. Musa and his colleagues are at the forefront of the fight against diseases that can affect the health of all. To create a healthier world, they need to work in collaboration with other sectors. The World Organization for Animal Health helps them come together with other experts to share essential knowledge, to build a global network, and to design a common response to global threats. Because we all share one world, we all share one health.
Okay, hopefully that would have helped you to understand that concept a little better. Let's get back here to the presentation. So this slide shows some of the very ambitious projects aimed at preventing zoonotic pandemics. So let's first talk about the elephant in the room, SARS, COVID, coronavirus 2. This is a virus that causes COVID-19. Although coronaviruses are classified as zoonotic, that is, they're transferred between animals to humans, to date, there has not been any evidence, any strong evidence to confirm animals as a source of the virus. And I stand to be corrected, so let me know. However, it is the first coronavirus to have caused a pandemic. So there's the PREDICT project, and this is something researchers across the globe have been working on since 2009 when it was developed, and serves as an early warning pandemic system aimed at strengthening the global health system. There are scientists in over 30 countries involved in the PREDICT project, and they continue to search for emerging viruses at their source, which can pose a threat to human health. And also they try to determine what role strategic investments can play towards strengthening the preemptive capacity for virus surveillance on rapid disease detection and response. Another project is the Global Virome Project. These scientists are also working to identify emerging viral threats. Their goal is to sequence nearly all wildlife diseases to determine which ones might spill into human populations. So from the diagram, we can see that 70% of emerging and re-emerging infections, and it could be more, because this is old, so it's probably increased, are due to vector-borne or zoonotic causes. So if you look closely at the map, you can see two infections due to arthropod-borne vectors. For example, you have the West Nile virus. Where is that now? Let's see, right there, the West Nile virus. And then, of course, let's see, what color is that? Yellow. You have also, and that's caused by mosquitoes, and you have chikungunya. And I see a couple spots. There's one up here, then there's one down here. And that's also caused by the mosquito. So those are the arthropod-borne vectors that cause those. Okay, then you have a couple of infections we can point out that are due to rodent-borne vectors. And you see down here, where is it, machupo. There's this one you call machupo, and how you acquire that is by inhaling the aerosolized viral particles, you know, from the urine or the excreta of the rodents, or eating food with rodent excreta on it. Okay, and then there's this other one here that's called Lassa. That's also caused by the ingestion or inhalation as rodents shed the virus in urine and droppings. Okay. I also want to point out two infections that may be caused by other vectors, you know, for example, bats. So here you have Ebola, and that's caused by the African fruit bat. Okay. And then, of course, you have the avian flu or SARS. That is caused by the droppings from infected birds. But the thing with that is the birds get infected from the urine and excreta of the rodent. So two of those vectors are really involved. But once the bird gets infected, they then go back to their, you know, to their families or what have you, to the flock, and they, you know, it's spread through their droppings. And that's a big issue in the United States right now. And so when of course, we have poultry coming into the country, we're going through trade, we have to make sure we have the proper import conditions to ensure that the poultry isn't raised on a farm where you have this avian flu taking place or anything like that. We have to protect our borders. So I looked at the objectives of the other two units. So let's look at the objectives of the veterinary health unit. And they are to promote animal health and production, excuse me, through good agricultural practices, or GAP. Also to prevent the introduction and spread of animal diseases and alien species. It functions also to regulate the trade in animals, animal products, and animal-related items. And finally, to give effect to the SPS agreement to carry out the sanitary and food safety measures to ensure animal health. Okay. The obligations, let's move to the next slide. The veterinary health unit has obligations, and those obligations can be international, national, and regional. Okay, so let's just talk a little bit about those national ones. So a few of them include, and this doesn't include all of them, but adherence to the Animal Health and Production Act of 2016, for which the Veterinary Health Unit is governed. The Food Safety and Quality Act of 2016, for which the Food Safety and Quality Unit, for which I'm director, is governed. Then you have the Fisheries Resources Jurisdiction and Conservation Act of 1977, the Animal Protection and Control Act of 2010, and Marine Mammal Protection Act of 2005. If you look at the diagram to the right, it shows the significance of this particular act, okay? And how important it is in protecting our marine species, which is an ecosystem of significant importance to the population and to the planet, okay? Then, of course, we have some regional obligations. with the Caribbean Agricultural Health and Food Safety Authority. That's the regional authority for which BAFSA is a member state. You have the CARICOM Chief Veterinary Officers, for which my colleague was a part, CARIVET Network. These are all regional organizations or obligations with which the unit cooperated and collaborated on. And then you have the international obligations, which include the World Trade Organization. We're not a member, we're just an observer. But of course, we try to, be involved in any way that we can as observers. And of course, the World Trade Organization agreement really spells out the application of the sanitary and phytosanitary measures that we follow at BAFSA. There's also the United Nations Sustainable Development Goals, the Convention on International Trade in Endangered Species of Wild Animals and Plants, otherwise known as CITES, CITES. And then, of course, you have the World Trade Organization on Technical Barriers to Trade. And of course, we have the Bahamas Bureau of Standards and Quality that deal with TBT issues, okay? And then there's the Convention on Biological Diversity, CBD, and the International Health Regulations. So these are all various obligations of the Veterinary Health Unit and partners who we work with to strengthen that unit. So there are a number of veterinary services that are necessary for the optimal functioning of the unit, okay? So let's start off talking about the laboratories. These are needed to assist in the identification of diseases and pests in order to effectively treat and or develop control or eradication programs with regards to animal health emergencies. Now, unfortunately, we do not have a laboratory, a veterinary laboratory, but we are working towards that end, okay? Then, of course, you have the phytosanitary program. This, of course, will ensure international trade of animals, animal products, and related items. This is the primary mandate of the Veterinary Health Services Unit. Then, of course, you have aquatic animals. They require effective regulation of the aquatic animal health at all stages to ensure sustainability of the industry. The animal production and food safety area, here the need is to establish a system that ensures quality assurance based on risk and the use of international standards for the production, slaughter, and processing facilities to ensure that food safety along the food chain is maintained so that agri-producers and processors can access all local and international markets on an equal basis. Then there's the veterinary products and antimicrobial resistance issue. So here we need to ensure that agri-producers again and processors have access to adequate amounts of veterinary drugs and feed to facilitate optimal animal health. Animal welfare is also very important because we want to ensure that the interaction between man and animal is within moderation, and safe and beneficial to all. And so, the animal control unit, the Surrey administration, all of those help to maintain animal welfare. And of course, you have wildlife, and here we want to implement our obligations relative to animal health, of our biodiversity, including the Convention on International Trade in Endangered Species, or CITES, and manage trade and possession of listed Bahamian wildlife. And then, of course, communication. Here we want to ensure that information is transparent and shared with the appropriate stakeholders and the public, who are primary stakeholders, in a way that sensitizes them to all matters associated with animal health. So that involves a lot of public education, training, and other sensitization measures. Okay, and then of course the administration. This ensures that there's a clear line of communication in the dissemination of information during an animal disease notification. So I know that the veterinary health, similar to the plant protection unit and also the food safety unit, have to develop an emergency alert plan to assist in dealing with any emergencies or notification of any emergencies. So what is the food safety responsibility within the veterinary health unit? Food safety, like I said, begins at the primary level of production, from the farm to the fork. Or, some people say from the boat to the throat or bait to the plate. I came up with one, I call it the fish to the dish, okay? Because think about it, fish can come from other sources other than the sea, right? So in an aquaponic system or some control system, you can raise these fish as well. During the hot summer months, sometimes, you have outbreaks of Vibrio parahemolyticus. That's an issue we have a problem with here in the Bahamas. As the sea temperatures rise, and what have you, we have this issue with the queen conch, okay, Strombus gigas, and typically we eat raw conch, okay, in the form of a conch salad, and so why this happens is, and we've noticed that typically you can trace this back to unhygienic storage of the conch in the water. It's normally closer to the shore. A lot of filth may be in the water. All of that helps to add to contaminating the conch. There's unhygienic washing and preparation of the conch. So all of these things help to cause this particular organism to proliferate. So it's just to show that every step of the food chain is important to maintain food safety. And so the same principles of food safety should be implemented, whether eating raw conch, in the raising of crawfish as seen in the picture up top, the top right, or in the handling of meat carcass at the abattoir, the bottom picture. The principles of food safety never change. Sorry, there goes the picture. Okay. So what is the capacity? The veterinary unit at BAFSA certainly has room to build capacity. In terms of government veterinarians, the post of Director for Veterinary Health has yet to be filled since the passing of Dr. Isaacs. The Department of Agriculture only has 3 veterinarians, and the Bahamas Agricultural and Marine Sciences Institute, otherwise known as BAMSI, which is located on the island of Andros, it only has 1 veterinarian. So technically, we only have 3 government veterinarians. There are many private veterinarians out there. So, as a government, we really need to see how we can encourage and bring them in. I think salary has a lot to do with it, but nevertheless, the capacity to grow there is great. So currently there are no authorized officers or veterinarians. Typically we would want to have perhaps some of the private veterinarians serve as authorized officers to assist in the duties of or the mandate of the veterinary health unit. So, but once the director of the post is filled, authorized officers definitely will be sought. So there's capacity there. Officers for which the veterinary health unit will have access to in fulfilling its mandate include the Department of Agriculture. They have the Animal Production Extension Officers who will assist the veterinary health director, also the Plant and Animal Inspectorate Unit. Otherwise they call it PAHUI, and Animal Control Wardens. Also, there's Department of Environmental Health Services inspectors who can also be of great assistance. In fact, they do the post-mortem inspection at the abattoir during the after the slaughter of the animal. Bahamas Customs also plays a role, and sometimes these officers, they have to multitask. They have to have some skills in order to perform the duties of other agencies, because other agencies may not have sufficient staff to fill, the complement at the border. Okay. So in terms of support personnel, those in the Department of Agriculture permit section can also provide assistance to the veterinary health unit as well. There goes Doc again. So this next slide looks at some collaborating agencies who we really, work with, or this unit will work with, just to strengthen, its capacity to follow its mandate. So from a national perspective, I would have already mentioned the Department of Environmental Health Services. And of course, you have to work closely with the Department of Public Health because, you have these diseases that are hopping, between humans and animals. There's the Department of Marine Resources that, has various issues that come about, the conch, the sponge, the different marine life. So we work, this unit will work closely with them as well. The Department of Agriculture, the Department of Customs, also the Bahamas Bureau of Standards and Quality. I remember sitting on a committee with Doc as the standards for poultry and poultry products, including standards on eggs and what have you, were being developed. Okay, so the Bureau plays a critical role in ensuring that standards are in place to support the work of the veterinary health unit. And then there are regional collaborations, as I mentioned before, CAFSA, CARVET, and the CCVO. International, there's the SPS committee, for which Doc sat on, the World Organization of Animal Health, OIE. And then, of course, you have Codex. Codex basically are a group of standards that is used by the Food Safety and Quality Unit to ensure that, the standards are being adhered to by consumers and that food is safe. Once these standards are followed by anyone, anywhere in the world, you can be assured that your food is safe, that it is safe to be traded, and that you should not become ill if those standards are being followed precisely. And it also helps to ensure, fair trade practices by following these international standards. And then there's also collaborations that take place with the Food and Agricultural Organization of the United Nations and the World Health Organization. So there's a lot of different collaborations and partnerships going on. So are there any risks? What about the risks? So when you think about animal health, the risk really is global, it's global in scope, and the threats are real. Think about it. We're able to import foods from every corner of the earth. And for every import arriving at our borders, we must ensure that sanitary measures are in place to make sure the food is safe for human consumption, or in the case of feed, for animal consumption. We also have to ensure these foods are disease-free and will pose no other health risk to consumers. What makes the risks even greater are fraudsters out there. And they're taking advantage of the gaps in the system, particularly after the onset of COVID, because COVID left the global borders very vulnerable, even to date. Okay. And then, you have online ordering. So there's a lot of room for sinister things to take place. So the risks have become even greater after COVID. So here's a quote by Maimonides. He was a Spanish philosopher. And Doc put this in here, and I really like it. It says, "May there never develop in me the notion that my education is complete, but give me the strength and leisure and zeal continually to enlarge my knowledge." Okay, so it's straightforward enough. And so I encourage you, class of, I think this is a class of 2024, right, Doc? I want you to be open. Yeah?
Yes, it is.
Yeah, be open to learn new things, have new experiences, and remember, life is a never-ending journey of education and enlightenment of the human mind. Remember that. And Doc also added this to his presentation at the end here. I think this is quite funny. The turkeys have bird flu. The cows have mad cow disease. I'm telling you, boys, unless we want to see more ham served on Thanksgiving, we're going to have to get our own disease. You know, it's serious. There's a lot of diseases out there. There are a lot of things happening. Food is becoming endangered, you know. So I encourage you, if you're not doing so, grow your own food, raise some of your own animals if you can. And so that brings me to the end of this presentation. If you want to get any information from BAFSA, you can reach us at the email there, at the website, phone, and of course, we're also on Facebook. Okay, so thank you so much for your attention. And at this time, I'll take any questions you may have. And I hope I can answer it from a veterinary health perspective. But if you have any food safety questions, definitely. That's it.
All right, good morning. My name is Vernon Davis. I had a question. It's more on the end of food safety. I know that sometimes foods are labeled as for export only. Is that for compliance issues, or is that a way that we have to monitor quality as well? I just wanted clarification on that.
Yeah, I've been trying to find the answer for that, and I've been getting multiple explanations. The first point you made is the one that has come up the most for compliance with, you know, the farmers would meet their quota on the US market, and so they only get subsidized for a particular amount. And once that's done, boom, all the rest of the product is labeled as for export only. So they're not able to sell it on the US market. Now that's the explanation, one of the explanations I got. But it is a matter of concern for consumers. We are presently developing our capacity within the Food Safety and Technology Laboratory that we have, which is an accredited food lab, to conduct more tests and what have you. So we're trying to build capacity in terms of equipment and personnel to be able to do more surveillance, you know, in terms of testing and what have you. But that's always been an issue with consumers. Yes.
All right, thank you. And is there like satellite locations within the Family Island, or is it centrally based in Nassau?
FAFSA? Yes, it's centrally based in Nassau. It's fairly new, it's very minimally staffed. And so our hope is, though, to have authorized offices throughout the Family Island. So that is something we definitely are working on, to have authorized offices, because we have food establishments and we have farms and animal rearing, crop growing. It's going on all over. So we need to cover those areas, and those authorized offices will allow us to be able to, or they'll be able to conduct some of the duties that are needed to help us to maintain, you know, the safety of our food throughout the islands.
All right, thank you so much. And it was a great presentation. Thank you.
Thank you. Any other questions?
I'll have a comment while the students think. We usually have them go to the food technology lab, but because of the, you know, the pandemic, we had stopped for 2 years, I think.
Mm.
And they would do that on the day that they do the marine production facility too, on Gladstone Road.
Okay.
So I was trying to get somebody from the Department of Marine Resources to do the tour, you know, and the talk, because they introduced the concept of HACCP to the students.
Okay, that's the laboratory you're talking about, or the
right, the food safety
technology
technology lab. Yes.
Mm-hmm.
So they would do that, then they would go to one of the um, marine resources, production facilities,
Yes.
and they would have gotten a talk before. So it was quite an interesting day, in relation to your area, of course,
Yes.
but it didn't work out this year. Apparently, marine resources are very understaffed and
Everywhere is understaffed. BAFTA is under,
right.
and I know right now the FSCL lab, I think, is trying to go through um, um, renewing their accreditation status. So I know they've been doing a lot of, auditing, the self-auditing and everything, and making sure everything is correct and what have you, so that can happen. So they've been
Okay.
pretty, yeah.
So who accredits a food safety and technology lab? That's an interesting point because
I can't remember.
mhm.
I think it's a European agency, and
Okay.
they had to become accredited in order to be able to export the marine species that we export. We export over, I think, 80 million. It might be more or less. I don't know, but it was at one point
Mhm.
over a million of dollars
How much million you said? 80 or 18?
no 80.
80 million. Okay.
Yeah, we export a
Yeah.
lot. We export a lot of marine species.
Yes. Yes.
And I had shown a picture there of tropical, I think they're called tropical seafood, but they grow in the fish in the tanks. They do a lot of exports as well, quite a bit to
Yes.
Japan, China, you all over the world. So we do quite a lot of exports.
Yes. Yes. The students would normally go to one of those facilities. I think even tropical was one of
Yeah,
them.
tropic seafoods or tropical, I can't remember the name,
Right. Um,
but it's an impressive facility.
um,
If they can get an opportunity to go there, that would be great.
yes, I'm gonna keep trying,
Yes.
so that they can see these things early in their careers to realize how complex, as you made very clear, this whole health system is.
Yeah, if you want to really get a good explanation of a HACCP program, I would even suggest right there at Cisco. Cisco, the wholesaler, um, they have a
Oh,
really tough HACCP program in place. So you may want to visit
who are
that.
they? Cisco?
Yeah,
I don't know that.
just before you
Um,
go to Tropic, Tropic is in the back. Tropic Seafood is in the
mhm.
back. Cisco is that building right in the front there on the same property.
Okay, okay,
They're the ones, the wholesaler that sell wholesale items. Yeah, they have
okay,
a impressive HACCP system there.
okay.
Mhm. You would have,
Can you
yeah.
tell them a bit about it while you're here as somebody in that field? Because
Well, now don't forgive me if I don't remember all the steps.
all the stages. Well, tell them what it is first of all. I don't know if we could ask it as a question to see if
Yeah,
anybody knows what it is.
yeah. HACCP stands for Hazard Analysis Critical Control Program. And basically, it is a food safety management system that you would apply to your company in order to ensure that you address any uh, um, risks that may arise. Say, for example, you're in a processing facility, you have to cook an item at a particular temperature. So one of the risks would be, hey, you need to maintain this temperature. If you don't maintain this temperature, then the integrity of that food is going to spoil. It's going to be compromised. And so this program allows you to identify different critical control points within your production or processing, whereby you would apply certain measures to ensure that they are maintained. And if they skew off of where they need to be, then you have to have control measures or action points that you would need to apply to that system in order to bring it back to where it needs to be. Okay, so let me see if I can just get the, see if I can get all the different steps. So the first thing you would do basically is to conduct what we call a hazard analysis. So by doing that, you would determine the different risks, whether it's a biological risk, whether it's a chemical risk, or whether it's a physical risk. Okay, so biological, you may have some microorganism, you know, that you have to make sure cook the food so that you don't have this biological risk. Chemical risk means that maybe you were cleaning, cleaning something, or some, these clean in place equipment, maybe some of the chemicals were not removed as they were being rinsed so they can get into the food, like the recent Capri Sun recall, where some of the cleaning solution was still in the clean in place equipment, so it got into the drink. That's a chemical risk, right? And then you have your physical risk, where you can have solid pieces of material, that may get into the food, hair. That's why it's important to also wear your personal protective equipment, like your mask, not your mask, but COVID has you wearing that, but your hair nets, your gloves, your aprons, and things like that, to avoid these risks. And then, so that once you identify those risks, you want to try and remove those risks, because they can cause illness, or they can cause some type of injury to the consumer if you don't remove them or control them, right? And so that's the first step, a hazard analysis. The second step, you would want to determine what those critical control points are. So as the example I gave you with the temperature, you want to identify that point or a step within your process where you can control and prevent or reduce the effects or levels of a food safety hazard. Okay, so you're supposed to be at this particular temperature, but because you're using a thermometer, you can monitor and you can say, oh, this temperature is not at 140. So this food is not going to be safe, because between 40 and 140, that's like the danger zone. You don't want food to be in that range. And so that is a critical control point. You need to control that. You need to check the equipment. Maybe something isn't working and the temperature isn't up. Okay, so you determine those critical control points within the process. Okay, and then third, you want to establish some critical limits. So what's the maximum or minimum value to which, like say for example, temperature or the time, or the presence of pathogens can you tolerate or can control or prevent to help to reduce this food safety hazard? My maximum temperature I need is 140. Okay, that's my critical limit. That's 140. And then the second one I mentioned, to determine the critical control point. Once you know what your limit is, and you can control that critical control point. Okay, so establish those critical limits. And then the fourth thing, it would be to establish monitoring procedures. Okay, so you want to be able to plan how you're going to ensure that a process or hazard is under control at a critical control point. Okay, so that is what the monitoring process is about. Okay, so somebody has to specifically have that job of doing the monitoring procedures to make sure everything is working, everything is under control. All right. And then fifthly, you want to establish some corrective action. So if something isn't working, for each critical control point where a critical limit is not being met. So we have the temperature example, that's the critical control point, right? The limit of 140 degrees Fahrenheit, that's not being met. Okay, so what actions do you need to take now to correct that? Okay, so that's what corrective actions are. hey, I need to check and see why this temperature isn't thing. Use a different thermometer. Maybe the thermometer isn't working. And if the thermometer still reaches the same thing, maybe the heating equipment isn't working, but you try to figure out what corrective action you need to utilize in order to correct that issue. All right. And the sixth thing to do is to have some type of record keeping process in place. Okay. Every measurement that you take at your critical control point, any corrective action that you implement, you have to document and record everything. Okay. Because you're going to have to use those records to go back to verify if you need to in the last step, where you have to establish, that's a step 7, you have to establish some type of verification procedure. So you, in that step, you have to ensure that the controls that the controls that you would have administered or whatever are adequate to help manage those hazards. Okay, you have to make sure that the system is working as it should. And so that's what the verification process is about. You must keep those records so you can do that. All right. And that'll help you to be able to assess your HACCP plan every now and then. Don't just assume your plan is problem proof. You want to go back and make sure, and go through these steps every now and then as you go through whatever process or system that you are analyzing. Okay, so a lot of companies, like I know Cisco, they have HACCP certification. You can get HACCP training and you can be HACCP certified, and for whatever operation that you're doing, if it's affiliated with food and what have you. And basically you get that certification, especially for companies, that gives the consumer more confidence that you're doing things the right way, and your food is safe and what have you. A lot of companies, of course, cannot afford to put these systems in place, but at least they should have the minimum level of food safety applications in place. Okay, to be sanitary, have sanitary environment, personal hygiene, environmental hygiene, and whatever. You have to have these minimum things in place. Okay, so that's basically the HACCP in a nutshell. It's 7 steps where you conduct your hazard analysis, you determine what those critical control points are, you establish what the critical limits are, you establish a monitoring procedure or process, also corrective actions, establish record keeping procedures, and also verification procedures. So that's HACCP. And that is what you would probably see at Cisco. They'll actually have the record keeping paperwork. They'll have it in plastic pouches on the wall. I read a group to tour that place some years ago, and I was just so impressed as to how they handle things. But the smaller companies, they may not be able to do it at that level, but they still need to have, like I said, these prerequisite programs in place where they are maintaining, sanitation and yeah. Hope that helps.
Excellent. You just gave a sub lecture, I guess we could call that.
Yeah.
Out of your main talk. Thank you so much. The other thing that comes up is this thing called Codex Alimentarius. Yeah. I know it was part of the thing, but can you outline that a bit?
Yeah, well, Codex is what governs food safety. Codex is like it can be described like a food Bible. I guess that's the best thing I could say for Codex. It's like a food Bible, and in this food Bible, it has all the standards. It has the codes of practice, and different types of guidelines and recommendations that food businesses, food operators, food houses use in order to ensure that the food is safe and, you know, ensure that the food can, and if the food is safe, it, of course, using the standards within Codex, that means you can trade that food. So that food can also be traded. And so, you know, and if everybody uses these international standards, it ensures fair practices in trade across the board, no matter what country you're in. Okay. Now, if someone wants to have a higher level of food safety than what is in the standards, they have to provide scientific evidence, because Codex is based on scientific evidence and research. Every single standard in there, you have a group of scientists that would work together to ensure everything that's within that standard was determined based on scientific research and application. So that's what the Codex is. Codex, it's really Codex Alimentarius Commission. I am the, as the BAFSA Food Safety and Quality Director, I'm actually the focal point for the country for Codex. And they have a million meetings all the time, but anyway, but whenever there's an update for a standard or anything like that, you know, they have meetings. Sometimes the standards really don't affect us. So you have a choice as to which, you know, which, but the documents, you know, we have an opportunity to review any and everything. Right now, there's a standard that's looking at the use of a growth hormone, a growth promoter, sorry. It's called the lopatolol hydrochloride, which veterinarians use, right? And so that is an issue right now with Codex. In fact, we're supposed to vote on that in November at the Rome, Italy meeting. And basically, it's in use already. It's already had scientific research attached to it. However, some 4 countries have some issue with regard to setting MRLs on maximum residue levels, even though it has already gone through the scientific, you know, research and basis and all of that, and is used. So that's an issue that we're dealing with right now. And, you know, we have regional meetings to discuss and what have you. So Codex is like a food Bible. It has those standards in there so that you can ensure, so that, you know, persons can use them who are in the food industry. They can use them, ensure that food is safe for the population. Any other questions?
Oh, sorry, I was asking one as a follow-up. What's the name of the chemical or the growth promoter? What does it do? This give us the name again. I didn't hear properly.
Zilpaterol is Zilpaterol. Zilpaterol.
ZIL.
PATEROL. Zilpaterol.
Oh, okay. Wow, never heard of it.
Hydrochloride.
Zilpaterol hydrochloride.
I don't know too much about it. It's a growth promoter. It's used by veterinarians for typically in cattle, you know, for beef producing.
Okay.
Yeah, it's used out there. It's just that this Codex is just working on the development of this standard to add to it the MRLs, or maximum residue levels, and that's where we're having some resistance from a few countries. Even one of those countries is the EU. The EU has done scientific research on it already, and has no problem with it being used, but they just don't agree with or don't want to move forward with the I guess MRLs. But that's yeah. So they're constantly having different standards up for discussion. It's just too much. It really is too much. We actually need a staff that deals specifically with standards, Codex standards, because it's just so much that is going on. And you know, my unit has 2 persons, myself and 1 staff member. And the plant
Yes.
unit also has one director and one staff, and then of course we have no one in veterinary health unit. So we try to, when some critical issues arise, we try to participate in that, as votes are needed. But other than that, quite a lot of things go on, and
Mhm.
not able to keep up.
Okay, I have another one at more local level this time. What can be done, with the Vibrio parahemolyticus outbreaks or sub outbreaks if they're not too big? I don't know how we define it, but I guess an outbreak is any activity above, the normal
Yeah, where you have
endemic or low level thing.
yeah,
So
or more persons.
especially in relation to education of
Yeah.
the vendors, because we see it now on the medical side when our patients come to us.
Right.
The end result of the poor hygiene, and we hear this, we interview the patient about what they saw the vendor doing, and some patients are not educated as to what should the vendor should be doing. So they'll say, oh, he just put in the bucket and
Oh,
he cleaned the conch on the same surface. And
oh
yeah,
no.
I've had a patient who got sick. Well, from Potterski. I mean, I might as well say where it was.
Yeah, that's typically where it emanates from.
So
That
what can
brings,
be done? Do you think we should educate them at the beginning of the summer? Should they actually do a course
yeah.
and pass it, and you literally
All
go
of
and
these things
inspect
you're
them?
saying
Or
have been, all of these things you're saying are valid points. The Food Safety and Quality Unit works closely with the Ministry of Health Surveillance Unit, okay? And also the Department of Environmental Health, because they're the agency that will go out and sample the conch and
yes, and
send it to the
inspect,
lab.
right?
Food Safety and Technology Lab, and also the Public Analyst Lab, or the MRAD Lab, which is the same thing, Environmental Monitoring. I forget what the RAD stands for, but anyway, that lab. And then sometimes we utilize the microbiology lab at PMH. And if, of course, if they cannot identify something, then we'll send it off to CAFA. But anyway, we have this relationship going on with all these agencies. And really, BAFSA has had some training to share with the vendors, not just at Porterski, but also Fish Fry out at Arawaki, also the Blue Hill Road uh, Fish Market, and also Montague. We've done trainings at these areas, but the training has to be consistent over time. And of course, like I said, staff. This is the issue. We've even created a video that speaks to the if you go on our Facebook page and you stroll through there, you'll see a conch video that speaks to what should be done during the conch preparation, excuse me, handling and preparation, but one of the things we would like to do is to develop a conch standard, which will outline, what all the steps, everything really that the conch vendor should do when producing this thing. But a standard takes a lot of time. Like I said, it takes a lot of scientific work and evidence and what have you. So we would most likely have to do that in collaboration with perhaps the some regional group or scientists or what have you. We can't do it alone, but the training has to be consistent throughout. But another thing that persons can do, like you say, we have to empower the consumer. The consumer they have to be educated and know what to look for. That conch should be rinsed over running water. Use a piece of lime to even increase the removal of the slime, because the parahemolytis, Vibrio parahemolyticus microorganism tend to collect within that slime on the conch. So if you don't wash it off properly, you're going to have an issue with that organism if it is been stored in, and typically persons store the conch in shallow waters. No, that in shallow waters, the currents are not moving too much. And of course, that gives that organism time to just go to town. You want to keep it out away from the dock just a little, where there's some current flow, so that current is constantly over that, and it's not too close to shore where the warm heat from the sun can get to it quicker as well, because the warmness also helps to increase its proliferation as well. In fact, over the warmer months, you would tend to see uh, um, cases of potential Kong poisoning taking place. And whenever the results come back, typically it's the parahemolyticus. Okay. But you also have cholera that can take place, and we don't ever want that to happen, because that can be very that can be worse. Especially for people who have cuts or compromised systems or what have you. But another issue that arises that or has been accounted for in terms of the unhygienic nature of the conch is the pollution, I guess, of the waters nearby where the vendors are operating, because they throw everything in the water, including any excrement, like they'll go to the bathrooms are far. Hey, so things end up in the water, and sometimes they'll have their conch right there behind their stalls, and so it's a cultural mindset. It is something that we have to work hard to change, but education and developing, like I said, a standard or some type of guidelines minimum to help would certainly help to reduce the occurrence of this microorganism. Well, I do have another meeting I have to drive to, so
Okay.
it's not too far.
Okay,
I do have to
great. But thank you very much. You had mentioned something about if you have a cut on some organism. What was that organism again?
I was saying sometimes, Vibrio cholera can also be
Oh, okay.
an issue, but
Right.
I think we had a potential scare with that.
Wow.
But that it can be very dangerous, particularly for persons with open cuts or compromised immune systems, or what tend to get.
Yes, boy. Well, that would be a tourism disaster, a cholera outbreak in the Bahamas.
Yes, it
That's
certainly
what I'm thinking about. Wow.
certainly would. It turned out that it wasn't cholera, so we
Thank
were.
God. Yeah.
Yeah, but yeah, that would be a total disaster. And a lot of tourists do get Kong poisoning. And what they do, they hop on the plane and they go back to their country to get medical attention. I guess they figure their medical attention is better. But
But it leaves a bad reputation. I mean, goodness.
once they write that on their Facebook page or Twitter or wherever they have their social media accounts, that can do great damage to the country. So
Yes, it can. So
but the thing is, a lot of people, us Bahamians, we self-medicate, we don't report it, and so that helps to skew the data. I think there are more people out there who probably get Kong poisoning and they just don't report it, because they're gonna stay home and try to fight it themselves. But I
that's
encourage,
true.
encourage your patients to always, report any illness, especially food illness.
Yeah.
Bush tea don't work for everything.
No, but you're right. There's some resistance, especially to even doing the stool sample. Like they'll
Yes.
come to you for treatment. You treat them, they get the sick leave, and then you say, "Well, I'd like to report this to the Department of Public Health, but I need you to do a stool sample."
And they don't come.
People say, "Oh no, I don't want to bother with that," and
Okay. Yeah,
and
I
I
hear.
said, "Give me the name of the stall." I can't remember the name of the stall. I said, "Well, go and get the name of the stall for me then, so I could report it." I said, then I tell them, "Well, you're protecting other people. It could be children eating from there, and they get really sick." And I try to appeal to them like that. And some people just don't, have that civic-minded spirit to say, "Okay, let me go back, get the name, come back."
Right.
But
Well, we have to just keep training
Yeah,
and sensitization to the
and
issue.
educating the public. Yeah.
That's right. That's right.
of- of-
Well, I just wanted to say thank you once again, Dr. Moxie, for inviting me to be a part of this process. And I wish
yes.
students here the best in your futures and just do well.
Yes, thank you very much. On
You're
behalf
welcome.
of for myself and on behalf, the students, we really
Yeah.
appreciated the time.